All right, then. So first of all, welcome everyone who has come for the demo today. And let's just start today's class. And today I will be covering virus as well as antimicrobials as already discussed. All right. Before beginning, just let me know, is my voice clear now? Is my voice clear? Just give me a thumbs up. All right. So I hope everybody has first aid with you so that you can refer to that while I am discussing the points with you. I'll be sharing the screen over here. All right. So I hope the screen is visible now. And those and one good news for everyone, like those who are going to stay till the end of the class, will get to have a Q&A with me. You can ask anything regarding USMLE. And another point, those who are staying till end, if you want a recording for today's class, I'll be providing you free of cost. Okay. So yeah, Ali Ahmed, आवाज नहीं आ रही क्या? That's all. Is my voice clear? Just give me a thumbs up. Okay, I think Ali, leave and join again. Okay, so let's just start. Coming to the general microbiome. So first of all, if you are solving UVL, you must have come across many questions regarding the general micro. But to be honest, the general micro is not tested in the exam. All right, so you can avoid general micro studying for the exam. Just do the UVL questions properly. Baki first aid mein whatever is given, you don't need to go into detail over here. Okay, so that's what I am saying. In UVL, there are 3 to 4 questions regarding this topic. All right. So there are 3 to 4 questions regarding this topic. I'm not saying they are not there in the like UL or in NBME. Okay. In NBME they aren't there, but in UL there are 4 to 5 questions regarding this. So if you want to get those correct in UL only, to just remember the definitions over here. From the exam point of view, this is not at all important. All right. Moving ahead, we have DNA viral genome and RNA viral genome. So yesterday when I was taking the microbiome first class, I already told all the students that were present yesterday. I told them ki always go for Sketchy Medical. Okay, Sketchy Medical is the best resource. No matter if you find anywhere you have the subscription from Telegram, if you have downloaded it, no problem. Just go with that and watch Sketchy Medical videos because they are going to help you to retain it for longer periods of time. Okay, so yeah, again I'm telling you, Sketchy Medical is the best resource for microbiome, and I have used it from. So I'm telling you from the personal point of view. And let's just begin. So DNA and RNA viral genome, they have given over a general info over here. Okay, so general info is okay if you like to remember in the general info, well and good. I don't like to remember the general info. I used to remember it learning along with the organism. Okay, viral envelope, DNA virus characteristic, all these are the general basic idea that they have given. So let's just skip that and come back to the main topic, that is DNA virus and what all information you need to remember. All right. So DNA virus, first one we have herpes virus. So herpes virus. Now, what all questions they are, they are looking out for. So first of all, they will confuse you with whether they are enveloped or non-enveloped. Okay, this is very important because sometimes you won't be able to figure out what type of virus they are asking you. Okay, so if you know this much, whether they are enveloped or non-enveloped, at least you can eliminate out so many options from that. Okay, so envelope and non-envelope very important. You should be thorough with that. All right. So let's just see what else is there. Another thing, they love to ask the structure. Okay, there is no trick to remember them. Okay, इतना कोई trick नहीं है. There is no trick to remember them. You have to look at it again and again. And if you have watched Catchy Medical, I think you are good to go for that. But if you have even solved UL questions and NBME questions, you must have come across many questions that they give, whether they are envelope, non-envelope, and they will ask you to know the shape and structure of the DNA present in this virus. Okay, so you have to remember this. You have to remember this no matter what. There is no shortcut to this. You have to remember. So let's just discuss the first herpes virus. We will discuss down that is in detail over here. Pox virus. So what is important here is smallpox has been eradicated worldwide by the use of live attenuated vaccine. So if you go back in the immunology part, when we have discussed about the live attenuated vaccine, you must have come across that. So what important is here is there is milkmaid blisters and this line they have used. Okay, in the NBME they have used the milkmaid blisters. So I want you to remember this milkmaid blisters. Okay, coming ahead, molluscum contagiosum, flesh-colored papule with central umbilication, keratin that contains molluscum bodies. Now see this image that they have given over here. Okay, this is the image, molluscum contagiosum. Now see, molluscum contagiosum, you have to remember that they have given flesh-colored papule with central umbilication. Now in the exam, they won't they might not give you the wording. What they will give you? They will give you this, and in the between they will give you flesh colored papule with central umbilication. So similarly, it looks like a target cell. If you have done pathology strong in the GIT, target cells is seen in the intersubscription. Okay, so target cells is also seen in. Can anyone tell me what is the one hematologic disorder where you can see the target cell? Anyone you can mention down in the comment section. Hematology part mein, it is a type of seen in the microcytic anemia. Yeah, the Dr. Alim has said correctly. Thalassemia, target cells is seen in thalassemia. Very good. So yeah, so similarly, it will also give a look like a target cell, but you have to keep in mind that they are talking about the virus over here. All right. So molluscum contagiosum is very important, and this question it was asked in UL. Okay, this question was asked in UL to make sure you know them properly. Another thing that they haven't mentioned over here, I'll write it over here. Okay, I'll write it over here. Has special DNA dependent RNA polymerase. Okay, so this line is very important again. Has special DNA dependent RNA polymerase. So all these small things is what you have to remember. And I know envelope and DNA structure you have to remember. You can't do anything with that. So that's it. That's it for pox virus. Let's move ahead for virus. Remember these two. Acute or chronic hepatitis, not a retrovirus, but has reverse transcriptase. So nothing is important here. But one important point is you have to remember the reverse transcriptase. All right. Moving on to adenovirus, you have to remember this. So febrile pharyngitis, sore throat, acute hemorrhagic cystitis, conjunctivitis that is pink eye, gastroenteritis and myocarditis. Now remember one thing. What they will say conjunctivitis seen in child. Okay, conjunctivitis seen in child, that is very important. And another one is outbreaks in military. Okay, so conjunctivitis seen in child and outbreaks seen in military. These are the two things how the case will be presented to you in the real exam. All right. So ये दोनों cases है, you have to remember it. And if you see something like this, along with conjunctivitis, if they are given hemorrhagic cystitis or they are saying pneumonia or gastroenteritis, so you have to keep this in mind. Sometimes what they will do, instead of gastroenteritis, they will give you intersusception. Okay. If you have seen intersusception in the GIT pathology, you must have come across adenovirus is the main cause of intersusception in children. All right. So adenovirus is very important. Remember the two cases that I have told you: outbreaks in military, second conjunctivitis seen in child, along with hemorrhagic cystitis, pneumonia, myocarditis. So these 3-4 symptoms you have to remember. All right. And what else is important is over here? Yeah, it is fecal-oral route. They haven't mentioned it. That's why I'm writing it down for you. Fecal-oral route. And another thing, It's spread through respiratory droplets too. Respiratory droplets B. So both of them are important. Alright, so that's it for adenovirus. Moving to papillomavirus. Again, remember this thing. HPV warts. So cervical, penile, or oropharyngeal. You have to remember the serotypes, okay? Because they will be telling you there is a lesion seen in the esophageal part or in the neck part. Okay, so for the neck, there is different serology, but for anus and all the genital part, there is different serology. So try to remember the serologies over here. That is 1 to 611 associated with what? And serotype 1618 associated with cancer. And another thing, 1 to 611 will be associated with esophagus also. Okay, and 1618 mostly will be associated with the genital part. So keep this in mind. They will give you one question, and then they will ask in the question itself. They will give you that the serotype this is used is causing what organ malfunction. All right. So make sure you know papilloma virus, the serotype. Polyoma virus. Again, remember this. JC virus, progressive multifocal leukoencephalopathy in immunocompromised patients, and BK virus, transplant patient. In BK virus, they will mostly focus on kidney transplantation. Okay, and this progressive multifocal leukoencephalopathy, JC virus, I think you have seen this in the CNS in demyelinating disorders. Okay, so you have to there one MRI is given, so you have to remember that. Not MRI, I think the X-ray is given. So try to remember that there is a white region that is seen on the I think the frontal lobe. So that is what causing so many factors, but that is responsible for demyelination. All right. So coming to parvovirus, again remember these features. B19 virus, aplastic crisis in the sickle cell disease. So slab chick rest in children. Slab chick so many times they have given in UVL. Okay, in UVL so many times they have shown the image of a baby with a red rash. That is what known as slab chick. Okay, so this is what erythema infectiosum of fifth disease, and they like to ask the different names also. All right, moving ahead. आरबीसी डिस्ट्रक्शन में हेल्प करता है हाइड्रोफिटोलिस एंड डेथ इन फीटस प्योर आरबीसी एप्लेसिया एंड रूमेटॉइड आर्थराइटिस लाइक सिम्टम्स इन एडल्ट इग्नोर दिस just remember ki B19 virus or slab tick is important. And another thing, when you are studying hematology, you must have come across 2 3 conditions where aplastic crisis is occurring, and where aplastic crisis is occurring you must have known about where the slapstick rash is there. All right, so make sure you know all this stuff. This is about the different types of viruses, and see they have not given in detail over here because in exam only 1 point or 2 point will be given in the 10 liner question, and you have to pick that out, and based on that you have to make the diagnosis. All right. So herpes virus we'll be discussing in detail because there are so many types of herpes virus and they like to ask questions regarding each type. So this is all about the general DNA virus that I want you to know. Whatever I have written and whatever I have encircled for you, each of that is having one question in the UL. So make sure when you are solving this, you should get them correct because I have already told you everything. Coming to the herpes virus. So herpes virus, the general feature they have already given above. Enveloped double-stranded linear virus. Recent data suggests both HSV1 and HSV2 can affect both genital and extragenital area. All right. So you have to remember कि if they are just talking about genital, it's not necessary that it is only has to be HSV2 or not HSV1. So symptoms might be combined. Just 1 or 2 factors will be there that is particularly present in one organism. Okay. So that is how you will differentially diagnosing it. The first one, HSV1. Route of transmission, respiratory secretion, saliva. Now, first, let me just tell you what is given over here. Later, I'll add extra point. So, what is important over here is gingivostomatitis is important, herpes labialis is important, keratoconjunctivitis is important, herpetic whitlow on finger is important, and the last one that is important is temporal lobe encephalitis. Okay, because so many times they have asked the questions regarding temporal lobe encephalitis. So many times, whether you take USMLE, whether you take NEET, whether you take FMG. Okay, any of the exam you have seen the HSP1 talking about temporal lobe encephalitis. Okay, so these 5 factors are very important, and in this herpes labialis and herpetic white these are very easy and these are the unique features. So you can focus on these 2 symptoms and think about HSP1 for sure. Okay, coming to the notes part. In the note part, they have given the most commonly latent in the trigeminal ganglia. Very important point. Most common cause of periodic encephalitis can present as an altered mental status, seizures, or aphasia. Now, if they're talking about encephalitis, usually some brain problem is going to occur. So this becomes not so important because as you are studying for USMLE, you must be knowing what is encephalitis. Okay, so I don't want you to say anything else. Okay, so these are all the important that is given in the book. Now, apart from this, what you need to remember, sometimes in the question they might say upper half of body. Okay, instead of saying just the face or trigeminal area, they will say the upper half of body. Okay, so you don't have to confuse yourself. Another, what type of rash they will say? So they will say dew drops, dew drops on rose petal appearance. Okay, so this is the characters line that I wrote down from the UL. So you have to do it no matter what. Another thing, serpiginous. I'll write it again. Serpiginous. Serpiginous lesions. Okay, serpiginous lesions seen in corneal ulcers. Okay, now serpiginous lesions means snake-like lesion. Okay, it means snake-like lesion. So you have to be aware about that. Snake-like lesions are seen on the corneal ulcers. All right. So I think that's it. That's it for all the. That's it. Okay. So for HSV1, that's it. These 3 points are the extra point that I want you to know. Coming to the second, that is HSV2. It occurs by sexual contact. Herpes genitalis is important. Neonatal is not important. They haven't asked any question. Herpes genitalis is important. Let's see. Most commonly latent in the sacral ganglia. One was in the trigeminal ganglia, two is in the sacral ganglia. It means the lower part of the body will be involved over here. Okay. Viral meningitis is more common with HSV2 than with HSV1. But as they have given this point here, so there occurs a controversy. But in the step 1 exam, they will mostly go with the temporal lobe encephalitis in HSV1. But make sure the other symptoms are also present with that. Okay. If they say that is genital herpes, then you have to think about HSV2. Okay. But if they are saying there is a herpes labialis or there is hepatic whitlow, okay, then you have to think about HSV1. Let me see another point that are important here is, yeah, painful inguinal lymphadenopathy. All right, so painful inguinal lymphadenopathy is very important, and inguinal lymphadenopathy is there. It means sacral ganglia was involved, lower part of the body will be involved. All right, so all these points are very important. And another thing is, yeah, in the UL they have written this for both one or two, whatever it is, intranuclear inclusion bodies. Intranuclear inclusion bodies is very important because at the end, if you're not able to understand the question, okay, question will be 10 to 12 lines, and sometimes you will be confused even after reading the question in the exam. So if in the end you will find intranuclear inclusion body, you can recollect it and then you can go for HSV1 or HSV2. All right, so that's all for 1 and 2. Moving ahead to another type of virus, that is varicella zoster virus, HSV3. So before discussing about varicella zoster virus, does any one of you know, if I give aspirin to any patient infected with varicella zoster virus, what will be that syndrome called? Anyone mention down in the comment section. If I am giving aspirin with to any patient infected with varicella zoster virus, what will be the syndrome known as? Can anyone quickly tell me in the comment section? No one? Can I guess? The answer is Reye syndrome. REYE syndrome. Okay, any if you give aspirin to any patients with viral infections, okay, and in USMLE they mostly focus on varicella zoster infection. Okay, so keep this in mind. Reye syndrome is very important. You should be knowing this, everyone. All right. Respiratory secretions contact with fluid from vesicles. As you know, varicella zoster is what in common language called chickenpox. Varicella zoster, chickenpox, and shingles. Now, see, guys, these shingles and chickenpox you should be able to differentiate. Okay, so this is what chickenpox and this is what shingles look like. You should be able to differentiate it. Okay, there is no other way. But in the exam, they will either ask you. They won't ask you about chickenpox. They will mostly ask you about shingles. So shingles दिया है तो confused नहीं होना है. All right. Coming back, it can cause encephalitis, pneumonia, everything. Most common complication of shingles is post-herpetic neuralgia, and this is important. Post-herpetic neuralgia is important. All right. So latent in dorsal root or trigeminal ganglia, CN51 branch involvement can cause herpes zoster ophthalmicus. So if there is a herpes and along with that there is ophthalmic problem, think about varicella zoster virus. Okay. And what else you need to remember here is okay. It can be reactivate with stress and aging. Okay, with stress and aging, it can reactivate. So this line is important. It was there in one of the NBMEs. Okay, so that's it for varicella zoster virus. Remember shingles and chickenpox. You should be knowing how to differentiate between them. Coming to Epstein-Barr virus, Epstein-Barr virus, respiratory secretion, saliva, also called the kissing disease. Okay, and it's most commonly seen in teens and young adults. So kissing disease is very important. All right. Mononucleosis, fever, hepatosplenomegaly, pharyngitis, lymphadenopathy, especially posterior cervical node. First, let me just highlight what is given, then I will discuss with you. Avoid contact sports until resolution due to risk of splenic rupture. Avoid associated with lymphomas, nasopharyngeal carcinoma, lymphoproliferative disease in transplant patients. Now, I'll mark what is important for you to remember. First of all, posterior cervical node. If in the question they directly mention there is lymphadenopathy in the posterior part of the neck, that is the posterior cervical node, first thinking should be going towards Epstein-Barr virus. No matter what, posterior cervical node का lymphadenopathy है, think about Epstein-Barr virus infection. Moving ahead, nasopharyngeal carcinoma. Agar if they are talking about some viral infection and they give nasopharyngeal carcinoma, first thinking should be going towards Epstein-Barr virus. All right. And another thing that they ask is they will ask you to diagnose that is a case of Epstein-Barr virus, and after that they will ask you what you should advise to this patient. So advice will be you will avoid contact sports until resolution due to splenic rupture, because the spleen has been so delicate in this patient that even a slight blunt trauma can also cause the spleen to rupture. Okay, so these 3 points are very important along with the kissing disease. Now let's come to the other point that we have to keep in mind while solving this. Infect B cells through CD21. Very important. Must be 21 to drink. Okay, this is a hint. Atypical lymphocytes on peripheral blood smear. Atypical lymphocytes on peripheral blood smear. This is what the pathology that they will be asking you. Third, monospot test positive. Heterophile antibodies detected by agglutination of CHIP or RBC. Now, another thing that they will ask you is monospot test positive. In the question, they will give you monospot test positive. Some viral organisms will be monospot negative, some will be monospot positive. So, if they are giving you about monospot positive, think about EBV. All right. So this is what all important. And in UWorld, one more question was asked. They gave the diagnosis of EBV, and they in the history they gave that the patient took an antibiotic. They didn't give the name of antibiotic, but they say the patient took an antibiotic, and as a result of antibiotic, there was a rash seen on his body. Okay. As a result of antibiotic, rash was seen on his body. So what is the case over here? That the patient was taking amoxicillin, and as a result, it has caused rash. So EBV, I will mark as a very, very high yield for the exam point of view, because so many questions have been asked in the exam, and these all are the features that you need to be aware about. Okay. Let me see if any other point I have forgot or not. Yeah. And in EBV, they have mentioned over here Burkitt lymphoma. So in Burkitt lymphoma, they can show you the image of Reed Sternberg cells. Reed Sternberg cells. Now, if you don't know how Reed-Sternberg cells look like, go back to hematology, go back to white blood cell disorder, have a look over there. All right. So that's all for EBV. Coming to cytomegalovirus, another very, very high yield. See, in the viral part, you will be confused between EBV and CMV. Definitely, you are going to be confused. Sometimes diagnosis is EBV, but you will feel that it's CMV. And if it is CMV, you will feel EBV, vice versa. All right. So just see congenital transfusion, sexual contact, saliva, urine transplant, everything is important. Coming to mononucleosis, but there is negative monospot. In EBV, that is positive monospot. All right. Especially pneumonia in transplant patients, esophagitis, AIDS retinitis, and what that's it. Congenital CMV, that is. Infected cells have characteristic owl eye intranuclear inclusion. So in owl eye intranuclear inclusion, you can look at owl eye intranuclear inclusion. Now, one more thing. Owl eye intranuclear inclusions and Reed-Sternberg cells, they almost look similar. But in Reed-Sternberg cells, it will be like this. Okay, there will be two sections, two cells together that you will be seeing. But in this, there is only going to be one, as you saw, intranuclear owl eye-like region. Now focus on the word intranuclear also. Okay, intranuclear is very important. Focus on this because in some of them intranuclear won't be there, and in UL they will be giving if it is intranuclear then only this, if it is not intranuclear then only this. So each and every one word you have to make a difference, and have to focus on each and every one word also. All right. So that's all for cytomegalovirus. I think. Let me see any other. Yeah, two important points that they haven't mentioned over here. Sensory neural deafness. Sensory neural deafness is also seen over here. Okay. And yeah, blueberry muffin rash. Blueberry muffin rash is seen over here. That's it. And they have seen that the age retinitis. So it can be only be possible if CD less than 50. Okay, so these two, three are the points that you have to keep in mind in CMV. So EBV and CMV, highly confusing points, and just look at them properly. Coming to HHV6 and HHV7, transmission by saliva, rhodiola infantum, very important. So high fevers for several days that can cause seizures, followed by diffuse macular rash. Starts on the trunk, then spread to extremity. Now, they will say कि starting May there was fever for 2 to 3 days, and after that, after the fever resolved, there was a rash seen on the skin. All right, so this is how you will be remembering this rhodiola infantum, and look at the age. It is mostly in children less than 2 years. Okay, so keep this in mind. Fever के बाद अगर you are seeing papillomacular rash, then that's it. Rhodiola infantum. Okay. That's it. HHV-8 sexual contact, Kaposi sarcoma, seen in HIV-AIDS and transplant patients, dark violaceous plaques or nodules representing vascular proliferation. So Kaposi sarcoma, we have seen this in dermatology, okay, and it is a malignant cancer, malignant vascular cancer. All right, so that's it. I think that's it. We have covered all with herpes virus. And what important point was there in HHV? Let me see. Yeah, two important points they haven't mentioned here. This regulation of VEGF, VEGF, vascular endothelial growth factor. Under point, in the case, they will give you Russian man and African man. Most commonly, they will give Russian man. Okay, most commonly, they will be giving you Russian. All right. So with this, we have finished it. And one important point is there. I forgot to mention down in varicella zoster. So there is one syndrome known as congenital varicella syndrome. And one question is there in UL regarding this, so I want you to know this. That's it. Limb hypoplasia, blindness, and cutaneous scars. Okay, so this is the triad for congenital varicella syndrome. In UL, they haven't asked the question on this, but in the UL, in other questions, this option popped up. Okay, so as you know, while reviewing UL, you have to be thorough with all the options. Okay, now coming to herpes virus, we have done this HSV identification. So this is very important. PCR of skin lesion is a test of choice. CSF PCR for herpes encephalitis. Jenks test, a smear of open skin vesicle to detect multinucleated giant cells. And see, as they have given outdated over here, but for your exam point of view, it's very important. They will give you Jenks smear and then they will say what is seen on Jenks smear. So multinucleated giant cell. This is what is seen on Jenks smear. All right, that's it. So here they have given intranuclear eosinophilic inclusions also seen with HSV1, HSV2. I already made you write it down while you were doing HSV1, HSV2. Where it was, yeah, internuclear inclusion bodies, so they are eosinophilic. Okay, they are eosinophilic, they are not any other neutrophilic or something like that. Okay, so they are given over here. All right, that's it. Now let's just see the summary over here. CMV ka integrins, EBV, CD21 I already told you. HIV will be discussing ahead. Parvovirus, we have P antigen on RBC, very important, highlight this. Rabies ka we will discuss early. Rhinovirus, ICAM is important. SARS-CoV-2 is 2. This is new information, and as it is involving COVID, they might ask you. All right. So this is what is there in the DNA virus. See, DNA virus may they will mostly focus on herpes virus type. Okay, rest all what we have discussed, they mostly won't focus on that, but mostly they will focus on herpes virus, and most commonly they will focus on cytomegalo and Epstein-Barr virus because those two are very confusing. Okay, just one test is differentiating them: monospot positive, monospot negative. Okay, so you have to keep this in mind. With this, we are done with DNA virus. Moving on to RNA virus. Now, RNA virus is very, very high yield, and some of the virus you don't have to remember in such great detail. So let's just see on this page what we have to remember. I told you similar thing in the DNA virus also. In the DNA virus, we have discussed the name, we have discussed whether it is envelope and whether RNA DNA structure. But here, another point that you have to remember is capsid symmetry. Okay, this is important because they will give you envelope and single stranded linear virus. Okay, envelope single stranded linear virus. This is how they will be explaining you in the question. Or multi-segmented non-envelope virus. Okay, so all this you have to remember. Along with this, you also have to remember 2 copies, 8 segments, 2 segments, 3 segments. Okay, so all of this also you have to remember. So देखो इसके लिए तो there is no trick. You have to solve question, and based on that you have to again and again look at this. Okay, so कौन सा envelope है, कितने segments है, what is the capsid symmetry, what is the structure, you have to remember. I can't help you in that. All right. So moving on to the negative virus, this is all the general thing that they have discussed in RNA, like we discussed in the DNA. So segmented virus, non-negative. So ये सब तो आपकी general हो गई. So basically, I avoid it because I like to do it with the virus one by one. So we will start with the picorna virus. Now see, in the RNA virus, they haven't talked about many viruses. So I'll be writing down the extra points for the virus that they have said. Okay. So picorna virus. What picornavirus includes is poliovirus, echovirus, rhinovirus, coccidiovirus, HIV. So all these are a part of picornavirus. Now, important point. RNA translated into one large polypeptide that is cleaved by virus-encoded protease into functional virus protein. This is the mechanism how the picornavirus is going to cause the inflammation in your body. Okay. Polio, echo, and coxsackie are entero and can cause aseptic meningitis. Not important. You can avoid it. So here only this much is given. Okay. So now picorna virus का definition उन लोग ने दे दिया. So let's just see the general information that they have said. If you have any question, please mention down in the comment section. I'll look into that. Okay. So they are positive sense. They are naked virus. They are fecal oral. Fecal oral. Okay. and your children are mostly affected. Children mostly affected. And what other point you have to remember here is, yeah, rhinovirus is not fecal-oral. Okay, rhinovirus is not fecal-oral. So this is the general idea about the picornavirus. Now we will discuss them one by one. The first one is rhinovirus. A picornavirus, non-enveloped RNA virus, cause of common cold, acid level destroyed by stomach acid, therefore does not infect the GI tract. Now they will ask you why the GI tract is not involved and why it is not infected by the rhinovirus. Your answer will be it is acid level. Okay, so it will be get destroyed by the acid present in the GI tract. Okay. Another thing, yeah, only upper respiratory tract infection. Only upper respiratory tract infection will be there. Okay. We have seen this enters the host through ICAM 1. Okay, this is important. And yeah, it grows best in cool temperature. All right. So all these are the points that you have to remember for rhinovirus. Again, one question is there in UL, not very high yield. It is a common case of it is a most common cause of common cold. Okay. Now see other virus they haven't given over here. So I will write it down for you. Coronavirus में we have done rhinovirus. So now we will discuss Coxsackie virus. Okay, Coxsackie virus. So Coxsackie virus, positive sense, naked. Okay, that's it. So what does it cause? It causes hand, foot, and mouth disease. Hand, foot, and mouth disease. Okay, and mostly in the question now in the exam or in the UL, what they have given is they say ki infection in children in summer month. Infection in children in summer month, and this is where you will be able to for sure diagnose that they are talking about Coxsackie virus. Okay. Another thing, there are two types of Coxsackie virus. So this was all about Coxsackie A virus. Now we will be talking about Coxsackie B virus. So Coxsackie B virus, most commonly it called dilated cardiomyopathy. Okay, type is a type of cardiomyopathy, but the heart is completely dilated. So go back to the cardiology section, look out all the parameters over there. The Coxsackie B virus is going to cause dilated cardiomyopathy, and it is also known as devil's grip. Devil's grip. Okay, the devil's grip is important. I think in NBME or UL they use this term. Okay, they use this term somewhere, devil's grip, so it is important. And that's it. That's it for Coxsackie virus. All right. So they haven't mentioned it over here, but you should be knowing it. Let me see what else is we are remaining. Okay, that's it. Only these two are important. Polio virus. If you want to do more about the polio virus, for polio virus you have to go for CNS. Okay, in the CNS part you can go for a polio virus. Not very important, so you can ignore this. Okay, HAV we will be discussing ahead, but echo virus ka no idea, no information is there, and no question have been asked for echo virus. So avoid that. Remember rhino. Remember this Coxsackie that I have written extra for you. Polio ke liye you can go back to the CNS part. HAV will be doing ahead, and echo ka there is no case, so you can avoid echo virus. All right. Coming to the yellow fever virus. Before yellow fever, let's just see the rotavirus. What is important in rotavirus is you have to think about the segmented double-stranded RNA, a reovirus. Instead of rotavirus, they might give you reovirus in the exam. Most important global cause of infantile gastroenteritis. Very important. Infantile gastroenteritis is the most common cause. Major cause of acute diarrhea in United States during winter. especially in daycare centers and kindergarten where all the children will be present together. All right. Now another point. Villus destruction with atrophy leads to decrease in absorption of sodium and loss of potassium. So this is what they will be asking you, the electrolyte disturbance in the rotavirus infection. Okay. CDC recommends routine vaccination of all infants except those with a history of intersubstitution not necessary. Okay. And the important point, they will increase chlorine permeability. They will increase chlorine permeability. Very important talk. Another point, NSP4 toxin. It causes secretory diarrhea. NSP4 toxin is going to cause secretory diarrhea. Okay. And what is the important point is, that's it. Okay. So whatever I've highlighted, whatever I've encircled, and the 2 points that I have added, this is what the questions will be asked, and each and this every point has a one question in the UL. Okay. So rotavirus is important. Now influenza, they have given it early over here. No problem. We'll do it as it is given over here. So influenza virus, moving to the influenza virus, orthomyxovirus. It is a class of orthomyxovirus. Enveloped negative single-stranded RNA virus with segmented genome, contains hemagglutinin and neuraminidase. Now see, hemagglutinin and neuraminidase. You know कि this influenza virus. Then if you move towards the paramyxovirus, all those contain hemagglutinin, neuraminidase, everything. But in the question, what they will ask, what is the function of hemagglutinin and neuraminidase? Okay, so this is where you will fail, and this is where you will forget in the exam. Okay, so hemagglutinin and neuraminidase का function आपको आना चाहिए. And another important point, yeah, this influenza virus, they will always associate it with the staph aureus. Okay, they will say that the patient was infected with the influenza virus. Now this patient is susceptible to what bacterial infection? Your answer should always be staph aureus. I'll write it down for you. Patient plus uh, influenza flu recovered, now got bacterial infection. So what is the bacteria responsible? The most common one is the staph aureus, and so many questions have been asked regarding this. Okay. Another important point, hemagglutinin lets the virus in, neuraminidase sends the virus away. This is how you can remember. So vaccine, the flu shot, you have to keep this in mind. And another thing is, yeah, antigenic shift and antigenic drift. So before knowing what it is called, antigenic shift or antigenic drift, they are caused by the influenza virus or causing pandemic or epidemic. Before that, you should be knowing what is the meaning of that. So infection of one cell by two different segmented virus, random mutation in hemagglutinin neuraminidase genes, minor changes in and so all these things. Just give them a read. Just give them a read, because when you will be doing about this in the NBME, they have given 2 or 3 new concepts. Okay, NBME में 2-3 नए concepts है, and in UL also recently they have added 2-3 more questions regarding this. Okay, so this is important, and let me see what else is important for you. Okay, one important point, that is the exception in this virus. It replicates inside nucleus. It replicates inside nucleus, and this is the exception. Okay, so virus that replicates inside the nucleus, you have influenza virus. All right. And in the question, sometimes they will give you reassortment, genetic reassortment or segment reassortment. So wherever you find this word, think about influenza. All right. Moving ahead, we have rubella virus, matona virus. Okay, in the old book they gave toga virus. Here they have given that matona virus. It becomes controversy, so they won't be asking this. Causes rubella, formerly called German measles, 3-day measles. Okay, so fever, post-auricular lymphadenopathy, atralgia, micropapillary rash that starts on face and then spread centrifugally to involve trunks and extremities. This line is very important, and this is how you will be differentially diagnosing rubella. Face पे start okay, फिर body में पास start हो रहा है. Okay, so keep this in mind. Another important point, classic triad of sensory neural deafness, cataract, and PDA. Okay, now you know when you have done PDA in cardiology, you must have come across rubella virus. ओके, तो रूबेला वायरस वेरी इंपॉर्टेंट. अगर हार्ट का प्रॉब्लम दिखा रहे इंस्टेड ऑफ पीडीए दे विल से मशीन लाइक मरमर. Okay, they will say machine like murmur. So don't confuse yourself. Machine like murmur is what PDA is. So PDA, deafness, cataract, all this very important. All right. Blueberry muffin appearance may also be seen, but that's okay. But these three becomes very important. And along with this, you have to remember that the rash starts on the face and then to the extremities and central. Another important point, it is 3 day measles. Okay, measles alag hai and 3 day measles alag hai. All right. Moving to paramyxovirus. Now, paramyxovirus, it causes disease in children. Okay. So these include croup, mumps, measles, RSV and human metapneumovirus. Metapneumovirus पे आज तक कोई क्वेश्चन नहीं आया. But RSV, measles, mumps will discuss. Another important point. All contain surface F protein which causes respiratory epithelial cells to fuse and form multinucleated cells. This line is important. This is what becomes the pathophysiology or the mechanism of the infection caused by paramyxovirus. All right. So palivizumab, that is monoclonal antibody against F protein, prevents pneumonia caused by RSV infection in premature infants. Okay. So palivizumab, ये drug याद रखना. Maybe in pharmacology they haven't covered this. New edition में they must have covered. I am not sure about new edition. So palivizumab याद रखना. It is associated with paramyxovirus. All right. So moving ahead, we will discuss acute laryngotracheobronchitis that is associated with the paramyxovirus. Croup से होता है. Okay. Also called croup. Virus membrane contains hemagglutinin. This is the function. And neuraminidase. This is the function. We saw this in influenza. Same यहाँ पे भी होंगे. Okay. Results in seal-like barking cough. Seal-like barking cough very important. Inspiratory stridor very important. See, if you don't know what is inspiratory stridor, it's okay. Question में mentioned होगा. Inspiratory stridor is seen because stridor and all those they are part of step 2 CK. It's not a important part over here. Okay. So inspiratory stridor क्वेश्चन में दिया जाएगा. So narrowing of upper trachea and subglottis lead to characteristic steeple sign on X-ray, and this is what known as steeple sign. Okay, so ये X-ray आपको पता होना चाहिए. Steeple sign is very important, and C questions have been asked on paramyx also. So seal-like barking cough, inspiratory stridor, and steeple sign on X-ray. This is all you have to keep this in mind. And यहाँ पे भी hemagglutinin and neuraminidase है, इन्फ्लुएंजा में भी है, आगे जाके मीजल्स में भी होंगे. Okay, so keep this in mind. Don't get confused. Another important point they haven't given here, RSV is the number one cause of pneumonia in infant. Okay, RSV respiratory syncytial virus. Okay, और यहाँ पे ट्रीटमेंट होगा रिबावरिन. Important. Okay, coming to measles virus, that is rubeola virus. Now sometimes in the question you will be confused between rubeola and rubella. Confused nahi hona. Rubeola is different, rubella is different. All right, let's just come rubeola discuss karte hain. Now first I'll tell you how the question will be actually presented in rubeola virus infection. Okay, let me just tell you. They will say there is a Koplik spot, that is bright red spot with a blue-white center on buccal mucosa, or they will give you this image. Followed 1 to 2 days later by a macropapillary rash that starts at head and neck and spread downward. Okay, basically they will give you this. So Koplik spot very important and most commonly they will give you. Okay, and Koplik spot के साथ second most important is cough and then conjunctivitis. All right, so Koplik spot very important. Along with that, they can give you cough and conjunctivitis. All right. Lymphadenopathitis with Barton-Finkeldy giant cells. This is the new thing. They haven't asked it. Okay, like during my time in my edition, it wasn't given. So it is a new thing. It means कि युवल के latest edition में they must have asked it. Okay, so कर लेना. Not necessary. Subacute sclerosing panencephalitis. So there will be personality change, dementia, autonomic dysfunction, death. Encephalitis. Symptoms appear within few days of rest. Giant cell pneumonia, rare except in immunosuppressed. Now see, all of this important. They might not ask you कब क्या होता है, इसमें क्या होता है, but they will say if they give you subacute SSPPE. So the first thing that should come to your mind is measles. Okay, SSPP दे रहेंगे. So some acute thoracic pain encephalitis they will give. Okay, so first thing you should think about is measles. Coming to vitamin A supplementation can reduce morbidity and mortality from measles. You will me there are two questions regarding this. Okay, pneumonia is the most common cause of measles associated death in children. All right, so whatever I have circled, how the case will be presented to you. Most important becomes Koplik spot, cough, conjunctivitis. All right, so this is all that you have to remember. Apart from this, SSPE अगर दिया हुआ होता है क्वेश्चन में, think about measles. Okay, that's it. We are done with measles. In the question, they will say there was low performance in school. Okay, in the question they will say low performance in school. So you have to keep this in mind. अगर school में low performance है, so this is what you will be going for. Okay, and here they have hemagglutinin, but they don't have neuraminidase. Okay, so this is also important point over here. All right, so that's it for measles. Moving to the mumps virus, uncommon due to effectiveness of MMR vaccine. Symptoms: parotitis, orchitis, aseptic meningitis, and pancreatitis. The most important one being parotitis, orchitis, and meningitis. So orchitis दिया रहेगा. If any viral problem comes with testicular infection, that is orchitis, think about mumps. Okay, and parotitis में ऐसी इमेज हो जाएगी. All right. And another important point over here, this orchitis that is there is unilateral. Okay, and here neuraminidase is present. So this is how you can differentiate between mumps and measles. Have HA but no neuraminidase, but here they will have neuraminidase but no HA. All right. So that's it for the paramyxovirus, and this is all about we will discuss later. Another important point I want you to discuss over here is polio virus का थोड़ा information लिख लो. Polio virus. It is positive sense, naked, acid stable. Rhinovirus was acid labile, but poliovirus is acid stable. All right. And another important point, replication occurs in pairs patch. Replication occurs in pairs patch. This is important. And yeah, now they will ask you about the vaccine in polio. Okay. So polio में Salk vaccine, that is killed vaccine, and it is about IgG. Another point, it is Sabin vaccine, and it is live attenuated, IgA. Okay, so that's all about the vaccine for polio that you have to remember. Now let's move ahead. We have arbovirus transmitted by Aedes mosquito. So arbovirus, it means that they are mostly present in the forest, arbo forest, tree, jungle, rainforest. Okay, so think about here, if they give anything, think about they are asking about the rainforest. And the rainforest ke liye countries, it can be either Amazon rainforest, it can be Bolivia, or it can be rainforest in Africa, Congo. They will give you in the case he went for trekking or he went for hiking in this rainforest. And when he came back, this all were the problems that he faced. Okay, the first one, chikungunya virus. In the old edition, these viruses are not discussed, but these are very important from the UL point of view. So many questions are there. So let's just see. Alpha virus, member of Toga virus family, transmitted by Aedes mosquito. Systemic infection that produces inflammatory polyarthritis. So other symptoms include fever, maculopapular rash, headache, lymphadenopathy. Okay, and how to distinguish it from dengue? So in dengue, there will be hemorrhagic fever. Whereas chikungunya में hemorrhage नहीं होती. Okay, and that's it how you will be doing for chikungunya and dengue. Symptoms will be similar in both of them. Okay, symptoms similar देंगे. One thing, hemorrhage they won't mention. If hemorrhage is mentioned, think about dengue. Coming to dengue, a flavivirus transmitted by Aedes mosquito, most common mosquito-borne viral disease in the world. Okay, dengue fever होगा तो fever, rash, headache, myalgia, atralgia, neutropenia, all those things you already know. Dengue काफी common है इंडिया में. And Dengue hemorrhagic fever, that is dengue fever plus bleeding and plasma leakage due to cytopenia, thrombocytopenia, then this is very high yield. They have asked, sorry, they have asked what is dengue hemorrhagic fever. They have literally asked. Okay, so think this, keep this line very important. Dengue hemorrhagic fever is the most common patient infected with different serotype, not necessary. Present similar to chikungunya virus and is transmitted by same mosquito virus, but only hemorrhage is the difference. Dengue virus is more likely to cause neutropenia, thrombocytopenia, and hemorrhage, shock, and death. So this is what I was telling you. Okay. That's it for dengue and chikungunya. They will mention. Okay, they will mention कि the patient went to the hiking in rainforest, and rainforest you have to keep the locations in mind. It can be Amazon, Bolivia. It can be any rainforest in Africa, that is Congo River Basin. Anything. It can be anything. You just have to keep that in mind. All right. Coming to yellow fever virus. Now, yellow fever virus is also flavivirus. Aedes mosquito. Virus has monkey or human reservoir. This is important. Okay. Symptoms: high fever, black vomitus, jaundice, hemorrhage, backache. May see councilman bodies. Just see, there are so many things in yellow virus they haven't mentioned here. So please write it down. It's very important for the second point of view. If in the question they say backache plus bloody stool, think about yellow fever virus. All right. Second important point: reservoir is also birds. Birds is also reservoir. Okay, they have said monkey or human reservoir, but birds भी यहाँ पे reservoir है. Under thing, Aedes mosquito तो है, but along with that, Culex mosquito is also important. Okay, and what it will cause? This is going to cause seizures, encephalitis, meningitis. Okay, and at the end they will cause flaccid paralysis. So please write this down. The question was asked in exam to me regarding this. Birds में reservoir है, and they gave me this symptom. I have to figure out what was the type of virus. So it is a type of flavivirus. All right. Another thing, it is also, you can also involve West Nile virus. Okay, West Nile virus भी yellow fever virus cause करता है. All right. Now coming to Zika virus. Zika virus is also, in this also they will give you the case of rainforest. Okay. Let's just see इसमें क्या है. Flavivirus most commonly transmitted by Aedes mosquito, causes conjunctivitis, low-grade pyrexia, and itchy rash. Outbreaks more common in tropical, subtropical climates. I told you. No definitive treatment. Sexual and vertical transmission occur, and in pregnancy can lead to miscarriage or Zika syndrome. Brain imaging is given over here, so keep this in mind. See, Zika virus wasn't in detail. It's not high yield. Okay, it's not high yield. So you can keep this in mind if you want to, but it's not high yield. Along with that, all these weren't there in the old edition of the first aid book. Okay, ये सारी चीजें first aid में पहले नहीं थी, but now they are there. Why they are there? Because in UL so many questions have been asked. In NBME so many questions have been asked. So I want you to do this properly. अगर नहीं है, take a screenshot of this page and add it in your old edition. All right, done. Let's move ahead. Rabies virus. Now in rabies virus, what important point you have to remember here is they ask about the mechanism, how the like how it is going to occur. So now see, first important mechanism here is travels to the CNS by migrating in a retrograde fashion after binding to acetylcholine receptor. This line is important. Okay, and another point that you have to remember in rabies virus is, yeah, replicates in motor neuron, and travels to dorsal root ganglia. Okay, it replicates in motor neuron and travels to dorsal root ganglia, and this is what is important in rabies virus. Okay, matlab this is so important. Rest all is also important, but this you have to focus on because so many questions have been asked based on the mechanism on how the rabies virus will be causing. Another important point that you have to remember here is They will give you any animal. Either it can be raccoon or skunk, and most common is dog bite. But in the US, raccoon and skunk bites are more common than dog bite. All right. So this is what you have to remember here. And even going to the bat caves is important. Okay. But if they give the bad droppings, then your answer is always going to be histoplasma fungi. Okay, अगर बैट के रिलेटेड कुछ भी पूछ रहे, then your diagnosis become histoplasma, not rabies. Okay, but first read the case what they are talking about. All right. Now coming to the various characteristics, it is a bullet-shaped virus. Remember this image. Negri body cytoplasmic inclusion. Negri body is very important. Rabies में दिखती है. Another point. Found in the Purkinje cells of cerebellum and hippocampal neuron. Rabies has a long incubation period, not needed. Post-exposure prophylaxis not needed. Progression of disease. So fever, malaise, agitation, photophobia, hydrophobia, hypersalivation, paralysis, death. So ये सब progressing होगी. And one important point, rabies patient scared of water. You must be knowing this. They just can't drink water. They are just scared. So as a result, dehydration हो जा रही है. So in the exam, case can be presented to you as a patient who is dehydrated, and as a result, this is what rabies is occurring. All right. So rabies what important है, especially the mechanism of where the virus is going to act. All right. Coming to the Ebola virus. Ebola virus is a filovirus following an incubation period. Incubation period देखो, incubation period UWorld में काफी पूछा है, but in the exam I didn't get any incubation period question. In the NBME I didn't find any incubation period question. So UWorld में दिया है, so based on that you can do it, but overall incubation period अवॉइड कर सकते हो. कैसे याद करो इतने सारे वायरस, इतने सारे बैक्टीरिया? हाउ इट इज पॉसिबल टू रिमेंबर द incubation day? Okay, so let's just see Ebola virus में what you have to remember. Can progress like abrupt onset of flu-like symptoms, diarrhea, vomiting, high fever, can progress to DIC, hemorrhagic shock. Now one important point, there will be hemorrhagic shock. So blood loss हो जाएगी यहाँ पे. Okay, blood loss is going to occur. Now let's see. Transmission requires direct contact with bodily fluid, fomite, infected bats or primates, high incidence of healthcare associated infection. Okay, so there should be a contact between the fluid. Only then it is possible. All right. Vaccination of contact, strict isolation of infected individuals, and barrier practices for healthcare workers are key to preventing it transmission. In UWorld, you will come across many questions. Okay, they will say a case was given, so and the case is responsible for spreading infection through droplets. So what the medical staff should be taking care about? So they should say, okay, if it is spreading to droplets, then I have to keep my nose covered. I have to be fully sanitized and everything like that. Okay, so that is a general part. I think Microme in this edition they must have given it ahead. We will see to that. If it is not given, you will. I think 10 questions are there. Just try to see what in what case what they have given the answer. All right. So moving ahead, we are done with the Ebola virus, and this is the new thing, severe acute respiratory system coronavirus syndrome 2. So during my time also COVID was there, but they didn't ask me any question related to COVID. But I think the UL may there are in the latest advancement there are so many COVID related questions I guess. So because of that they must have given this COVID. So कर लेते हैं, and as I don't know what is important from COVID, so I would really suggest you to go through all the information given here, because during my time COVID के related no question in NBME, no question in mock test, no question in exam. Okay, so COVID के लिए I'm not discussing, you just go through it by yourself. All right. So we are coming to the hepatitis, and after hepatitis we have HIV. So before doing hepatitis, I want to discuss with you a few types of virus that they have not mentioned in the first aid. So first एक लिख देते हैं कलीसी वायरस. Calici virus. Okay, so in Calici virus, what they will give you, they are positive sense, naked, and the mechanism will be same as picorna virus. Okay, mechanism same एज पिकोना वायरस. पिकोना वायरस का मैकेनिज्म देखना, आई हैव हाईलाइटेड इट फॉर यू. Same as picorna virus. What is important here is there will be outbreaks in daycare centers and schools. All right. And one important point that you have to remember here is consumption of shellfish, and there will be explosive watery diarrhea. Okay, so these 2 points are of utmost importance. They will give you shellfish and explosive diarrhea. These 2 points very important, and mostly they will give you a case of infants or children in daycare centers or school. Okay, so Kalisi virus is not given in the first aid, so please write it down. It was asked in UL and it was asked in NBME as well. And to surprise, it was asked to me in the exam. तो फर्स्ट ईयर में नहीं दिया है. Write this down. Very very important. Now let me see what else is pending and not given in first aid. I'll write it down for you. Okay, two important points. Another virus that I will be talking over here is arena virus. You have arena virus. Okay, so arena virus is important. Arena virus में two lines are important. There will be grainy appearance on electron microscopy. It is due to rodent transmission. It is inactivated by heat. Okay, so that's all you need to remember for adenovirus. And another point, bunya virus. See, they have not given in detail in first aid, but if you look over here, right in the beginning, they have given everything. Okay, they have given everything. They have given delta, bunya, arena, everything, and they have given just one or two lines. Okay, so please give this a read and see. It is very difficult to mug up the envelope as well as the structure. So I would request you take the printout of this page and stick it in front of your study table where you often see here and there. Okay, so let's just see bunya virus. What I want you to write down in bunya virus, write down the reservoir is deer mouse. Most common is hantavirus. Okay, in UL for both of them, one question is there. One question for arena, one question for hantavirus. Let's just see what is problem over here. In hantavirus, it is transmitted by rodent feces. Okay, rodent feces say it is transmitted. Okay, and what else is there? Yeah, the symptoms of hantavirus that they have given in the UL was, I'm writing it here. It will be the patient will be shaking, the patient will get seizures, and there will be hemorrhagic fever. Hemorrhagic fever, and another point, there will be pre-renal azotemia. Yeah, it means kidney problem is also occurring. See, it is not very important, but one question was there in UL, so you just can't afford to take a risk. All right, so that's it. These are the extra virus that I want you to remember. Now coming to the most important part, that is hepatitis. Sorry, hepatitis virus. Okay, so hepatitis virus, the first state has done a good job giving all the virus and the distinctions over here. But apart from this, what you need to do is, if you're a graduate, you must have studied about the various lab values, HBsAg, HbCAg, HbEAg, all those stuff. You must have studied that in medicine, right? And if you're not a graduate student, if you're not a graduate, and if you are studying in a med school, in the final year when you will be studying medicine, you will be coming across all the lab values. Okay, so my point of view is, instead of doing all this, see, this is important. Okay, this is, I'm not trying to like, don't do this, do this, but in like, I'm talking in the important way. what is more important I am talking. So more important is doing the serum marker, because this is what the clinical symptoms and everything. It is easy to diagnose, but when we go how to diagnose, like HB hepatitis B hai, so HBs AG positive hai. Now the next question they will ask is whether it is a current infection or whether it is an old infection. Where there you have to play the role of IgG, IgM. Okay, then this is how they are going to confuse you. Okay, so if you are a graduate, medicine की book खोलना. If you are a med student, medicine की book खोलो, go through it. Okay, whatever you're using in India, marrow, prep, anything, at least go through and watch the hepatitis part, and you will be good to. All right, so let's just discuss what is given over here. एपिसोड ऑफ फीवर, जॉन्डिस, एएसटी, एएलटी हो जाएगी. ये तो सारे हेपेटाइटिस वायरस का ये है. ओके, नाउ सी most common becomes hepatitis B virus. So hepatitis B DNA polymerase has DNA and RNA dependent activities. Upon entry into nucleus, the polymerase complete the partial DNA, host RNA. तो ये सब फालतू है. This is just they have given to confuse you. Okay, so ये आप छोड़ सकते हो. I will write it down for you later when we discuss HBV. Okay, coming to HAV. Now see, HAV and HAV, these two virus, hepatitis virus, they are by fecal-oral route. ओके, फीको ओरल रूट से ये जाते हैं. फीकल ओरल रूट. इंक्यूबेशन नॉट नेसेसरी टू नो. क्लिनिकल कोर्स एक्यूट एंड सेल्फ लिमिटिंग है, अपने आप ही ट्रीट हो जाएंगे. फुलमिनेंट हेपेटाइटिस इन प्रेग्नेंट. नाउ इफ दे गिव अ केस ऑफ प्रेग्नेंट फीमेल, if they give a case of pregnant female and they are asking you about hepatitis, so your answer will be hepatitis E virus, no matter what are the symptoms they give. अगर प्रेग्नेंट फीमेल कह रहे हैं, यू शुड डेफिनेटली गो फॉर हेपेटाइटिस ई. आंख बंद करके हेपेटाइटिस ई. ओके, तो प्रेग्नेंट फीमेल अगर केस आ रहा है, डायरेक्टली हेपेटाइटिस ई. नाउ कमिंग टू प्रोग्नोसिस, गुड, बट देयर इज हाई मोर्टेलिटी इन प्रेग्नेंट पेशेंट. HCV नो, नो. Liver biopsy. So liver biopsy is important. Hepatocyte swelling, monocyte infiltration, all those stuff. Patchy necrosis. Okay. Note, no carrier state. They won't touch. Now, one important point I want you to write down is clinical course may there will be this will be because of contaminated water. Now, as you have already know कि we have written fecal oral route. So अगर पानी खराब होगा, खाना खराब होगा, so definitely this is what going to occur. All right. Another thing. प्रोग्नोसिस में जॉन्डिस एडल्ट्स में इज गुड. ओके, एंड yeah, in the UL they have asked how will you treat or how you will prevent. The answer to that will be bleaching, UV radiation, and boiling the water. Bleaching, UV radiation, boiling the water. They have asked this, so this becomes important. Okay, now we'll do B and D later. Let's first cover HCV. Primarily blood injection, drug use, post transfusion. Incubation is long, may progress to cirrhosis and carcinoma. Now, one important point. If in the question they ask you which hepatitis virus may progress to carcinoma or cancer, your first answer should be hepatitis C, not B, not D. Because in hepatitis B, 90% of the cases are resolved. Okay, but hepatitis C are not resolved, they will progress to cancer, hepatocellular carcinoma. All right. So अगर कोई पूछता है whether it is NEET, USMLE, FMG, anything, if they are asking hepatitis causing carcinoma, hepatitis C is the answer. All right. Lymphoid aggregates with focal areas of macrovesicular steatosis. This is you have to remember. All right. Now another important point they have given in the introduction over here, but I want to write it. Okay, so you can see this line only over here. This point. HCV lacks 3 days, 5 days exonuclease activity, no proofreading ability, antigenic variation of HCV protein. Okay, so this is important. If in the question they say that the microbe or the virus is lacking 3 days, 5 days exonuclease activity, you have to diagnose it. Okay, now coming to HBV and HGV. Now HGV का कोई अलग से inflammation नहीं है. If there is a presence of HGV in the body, HBV has to be present. HBV होगा तभी HGV होगा. You have to keep this in mind. All right. So HBV, the causes are parenteral, sexual, and perinatal. And initially, like serum sickness, fever, arthralgia may progress to carcinoma. May progress to carcinoma only 10%. 90% will be resolved. The adults mostly full resolution. If it is neonate, only then there will be worse prognosis because neonates don't have a proper build-up body system with them. Okay. HCC is yes, yes, इसमें तो होता ही है, इसमें भी yes है, but hepatitis hepatitis C has the most highest risk. Okay. Ground glass appearance is important. Accumulation of surface antigen within hepatocyte, cytotoxic T cell mediated damage. And hepatitis B का एक ही रीजन है, super infection with hepatitis B. So this is all about the hepatitis B and D. I want you to remember. One extra point I want you to write down. जो ऊपर दिया हुआ है उसको simplify कर देते हैं. Hepatitis B has reverse transcriptase. Okay, reverse transcriptase है. Replicates both inside and outside. Okay, and that's it. ओके, रिवर्स ट्रांसक्रिप्टेज है, ऊपर बस उन लोग ने कंफ्यूज करने के लिए बड़ा चढ़ा के दिया हुआ. ऑलराइट, हेपेटाइटिस हो गया. नाउ एक्स्ट्रा हेपेटिक मैनिफेस्टेशन ऑफ हेपेटाइटिस बी एंड सी. एक्स्ट्रा हेपेटिक याद करना है बिकॉज हियर व्हाट इज इंपॉर्टेंट इज renal and vascular is important. In renal you must have come across hepatitis B. Nephrotic और hepatic syndrome में कौन से वाले hepatitis B और hepatitis को करवा रहे थे? Let's just see. Membranous glomerulonephritis is more in hepatitis B, whereas membranoproliferative is more in hepatitis C. Okay. Vascular में polyarteritis nodosa. You must have seen in the vasculitis part HB AG का present है. So hepatitis B. And यहाँ पे leukocytoclastic vasculitis. This word, one question is there in UL. Okay, only one question, they haven't asked in NBME or anything else. Okay, now coming to hepatic. 1 minute. All right, now coming to hepatitis serologic marker. This is what I was talking to you about. So इसमें बस इतना याद रखना कि if they are I'll tell you, no problem. First of all, you should be thorough with this table. Okay, you should be thorough with this table. You should be thorough with IgM and IgG also. Okay, IgM IgG भी important है. Now HBH HBV है, window है, chronic है, low infectivity, high infectivity is also important. They are asked separately. Okay, this table becomes very high yield. You can see the explanation through this graph. अगर नहीं आ रहा है, so I would try to not try to, ask your friend to lend you prep ladder for at least one day. And prep ladder में दीपक मारवा सर की जो हेपेटाइटिस की वीडियो है, आई वुड हाईली रेकमेंड टू वॉच दिस. आई डोंट नो अबाउट मैरो, राकेश नायर सर ने भी अच्छे से पढ़ाया ही होगा. वॉट एवर यू हैव, प्लीज स्टडी दिस इन डिटेल because this is where you will be making questions wrong. So many questions, they will be focusing on this marker and each of these markers is very important. बस देख के पता चल जाना चाहिए कि ये मार्कर दिया हुआ है, what is the answer. All right, this is very important. बस एक हिंट दे देता हूँ, अगर HBE दिया हुआ है तो इट मीन्स हाई ट्रांसमिसिबिलिटी. इट मीन्स कि ये प्रेग्नेंट से उसमें बच्चे में और चाइल्ड there is high transmissibility. Okay, or wherever the HB age is given, it is going to be poor prognosis. Rest all के लिए I again request you कि अच्छे से इसको करो. So many questions will be there and this is very easy. एक बार आपने समझ लिया, once you have understood this, you will be doing all the questions correctly. Okay, BNB hasn't explained it so good, so that's why I'm saying मैरो या preparator जो भी हो आपके पास, or even you can go to YouTube. देखो, just try to understand. All right, moving to HIV. HIV not so important. Okay, now how it is not so important? HIV के infection is important. You know, they will ask you anti-HIV drugs. They will ask you HIV के patients में what are the opportunistic infections that we see. They will ask you that, but they won't ask you specifically HIV का. But few points are important. Let's just see what they are. First of all, ये सब याद कर लेना इसमें. Okay, what are P24, what are GP41, they can give you this. So diploid genome, 3 structural gene, protein conjugate for ये. So remember the functions of each and every protein. Okay, because the same thing you will be asked in pharmacology. Okay, pharmacology में if you remember the functions of protein, you are good to go for the mechanism of action of drug. All right, so that is what important. And yeah, only the name of proteins and what are the function. That's it. Nothing else is important in HIV. Diagnosis करने में ज्यादा कोई दिक्कत नहीं आएगी. एक बार ये go through कर लेना. And yeah, in UL there is one question in which they say कि अगर HIV का diagnosis नहीं है, HIV 1 का diagnosis नहीं है, so it might be HIV 2. Okay, if it is not a diagnosis of HIV, you can't say that the patient is not diagnosed of HIV. You have to look out for the HIV 2 का possibility also. All right, so एक बार ये देख लेना. Not important. NBME hasn't asked it. Neither I got any question of HIV in the exam. But UL में है 4-5 question. So just एक बार ये देख लेना. And yes, but yes, remember the name of the proteins and the functions. Pharmacology में बहुत help हो जाएगी. All right, that's it. You can ignore this. Not needed. Yeah. Now this is important. This is very very high yield. Not important. Very very high yield. And there is nothing to understand here. What you have to do is you have to see अगर 500 से कम है, 200 से कम है, 100 से कम है, what all will be there. And sometimes you can see a candida दोनों में है, but they are causing different problems in different. Here they are causing oral thrush and here they are causing ulcer. Mark my word, this is very important page, and you will be confused. They will directly give you the cells less than that, and in the option they will give you what are the opportunistic infections that can be seen. All right, so make sure you know this properly. Coming to prions, in the prions, we have done this in this CNS, Creutzfeldt-Jakob disease. It is a type of dementia disorder. And what all is important over here? Nothing else. The same thing we did in the CNS. Prion diseases are caused by conversion of normal protein-induced PRP to a beta-pleated structure, which is transmissible via CNS-related tissue. This is all that we did in Creutzfeldt-Jakob disease. Okay. बोवेन स्पॉन्जिफॉर्म के लिए मैड काउ डिजीज कुरु के लिए नॉट एट ऑल इम्पोर्टेंट, ज्यादा क्वेश्चंस नहीं है. बट क्रूस्टल जैकब डिजीज के सीएनएस में देयर आर मेनी क्वेश्चन, सो यू हैव टू डू दैट. नाउ सी, दैट्स ऑल अबाउट द माइक्रोब एंड एवरीथिंग. बट if you want to revise and if you want to have a strong base in microbiology for a step 1, okay, I'm not talking about NEET and FMG, okay, because the this first aid is not at all used for FMG and NEET PG, because I have seen the previous year's question in NEET and FMG. They focus more on fact base. So fact base involves remembering the culture mediums, remembering the uh, various chemical stain. USMLE won't focus on that. USMLE will focus on systemic. Okay, so just give a read from here. Just give a read. It is going to be a revision for you. You know everything. You know everything. This is just a revision for you. अगर कभी पूरा माइक्रोबायोलॉजी यूज करने रिवाइज करने में बोर होते हो, then always go and you go through this. This will help you to solve many doubts. And yes, अगर कुछ करो ना करो, ये तो जरूर कर लेना. Okay, this is very very high yield. They will ask you whether trichomonas है, bacterial है या candida है. So these features are very important. Okay, so this is just the revision of what we have already discussed. इसमें images दी हुई है, so with the images you can be easily able to pick out in the exam also ये image किसमें थी. All right, again torch infection. Remember, everything we have covered earlier. Okay, everything we have covered earlier. That's it. So that's it for microbiology. So let's take a 5 minute break, and we will continue with antimicrobials. Okay. In the meanwhile, if you have any question, you can mention that in the comment section. It's a 5 minute break. You can do whatever you want. All right, let's continue. So we'll start with antimicrobials. Now see, antimicrobials, they have asked so many questions, and it becomes very important. And antimicrobial is one of the part of pharmacology where you have to refer sketchy pharma. Okay, so along with the CNS, antimicrobials, and I think one or the other system I used to recommend to my students. I always recommend Sketchy Pharma for these two, three systems. Rest all you have to do by yourself or in the first aid BNB or whatever the app you are using. Okay, but antimicrobials in Sketchy Pharma is so good, and if you have the chance, please do it. Okay, so this is what they have given in summary over here. They have given the protein synthesis, they have given peptidoglycan, cell wall synthesis, membrane integrity, everything they have given. This is just a summary for you. All right, let's just go through each one of the drug. It is very big, so let's try to finish it as quickly as possible. So penicillin G. G is in IV and IM form. Penicillin B is oral. Okay. So what important is the see, first important thing that you have to remember in antimicrobials is you have to remember the mechanism of action properly. To the word, you have to remember mechanism of action. They won't change any wordings in the exam. They will give you the same wording given in the first aid. Okay. So what you do is write the name of the class of drugs like penicillin. I have penicillin where you have this carbapenem, you have ethionam. So what you do is write down the mechanism. ओके एक पेज में मैकेनिज्म लिख दो और सबके मैकेनिज्म्स को लाइन में लिखना so that you get to know, yeah, in the question they have mentioned this mechanism, what will be the drug. In the question they have mentioned this drug, what will be the mechanism. Mechanism of action is very important when you are dealing antimicrobial. Side effect is a secondary thing. Okay, pharma is after all basis of mechanism and side effect. That's what we learn in pharma. Okay, so let's just see one by one. So mechanism तो आपको याद रखने ही है. These two lines are totally mechanism. Okay, so mostly for gram positive organism और कुछ नहीं है. ग्राम पॉजिटिव के लिए आप ये दोगे. And adverse effect is hypersensitivity, drug induced intestinal nephritis. Now see, one important point is there in UL that they give. Beta lactam cause time dependent killing, whereas aminoglycosides cause concentration dependent killing. Okay, this line is important. You will make one of the question was there. I have written it down, so you can also write it down. And two important points you have to in side effect is drug induced intestinal nephritis. We do this in the intestinal nephritis in the renal part. Okay, and hypersensitive reaction is another part. Okay, so two side effects, mechanism of action. We give this in gram positive organism, and this is the extra point that you have to remember. That's it. Done with the penicillin GLB. All right. Coming to another point, another drug, penicillin sensitive and penicillin resistant. Okay, the penicillin sensitive में we have amoxicillin and ampicillin. Amoxicillin and ampicillin very high yield drug because most of the time this is the most common antibacterial that we give. Okay, अगर penicillin से वो sensitive है so we will go for amoxicillin and ampicillin. Okay, so let's just see. It is wider spectrum. It will be having same mechanism as that of penicillin. Okay, and another point that I want you to remember over here is this. Amoxicillin has greater oral availability than ampicillin. Aminopenicillin or MDAP penicillin. That's it. They are not going to ask you this microbe hai, what will be the drug of choice. They are not going to ask you. Okay. So in this, just remember same mechanism, and they will ask you if penicillin resistant, what will be your drug of choice. Again, same. Now remember, when we were doing bacteria, we came across pseudomembranous colitis, Clostridium, I think difficile, Clostridium difficile. Okay, so pseudomembranous colitis, it becomes very high yield. Okay, in the case they will give you a person took amoxicillin or ampicillin, and later on there was this gastroenteritis in the patient. So gastroenteritis is pseudomembranous colitis, and reason for this is because the patient was taking antibiotic. Okay, this is very important. Pseudomembranous colitis is very important. We have discussed in the antibacterial, sorry, in the bacteriology. Okay, penicillin resistant. You have to remember this drug, same as penicillin. Okay, and another thing is Staph aureus. That's it. Same side effect, same mechanism, everything. All right. Coming to piperacillin, same as penicillin, but piperacillin is specially modified for Pseudomonas. Okay, specially modified for Pseudomonas. Now, one thing, whether it is NEAT, whether it is FMG, whether it is USMLE. Vancomycin, we will be doing this ahead, but I am writing it down. Vancomycin is not effective against Pseudomonas. Please write this down because sometimes you will make mistake. If you diagnose Pseudomonas in exam, please never mark vancomycin as the treatment for it. Okay, so that's it for this penicillin based drug. Now we'll move on to cephalosporin. Now in cephalosporin, each and every generation will be having few features that you have to keep this in mind. Mechanism will be same as penicillin mostly. Okay, so चलो देखते हैं first generation में you have cefazolin and cephalaxin. Yeah, one important point I want to tell you, you have to remember the name of drugs in various generation. Okay, name of drugs are very important, and believe me, Sketchy Pharma has done so good work in helping you to master the retention of this drug. Okay, so let's just see. First generation drug, you don't have to remember this organism, they won't ask you. So what is used over here is cefazolin used prior to surgery to prevent Staph aureus infection. So this is important. He surgery से पहले first generation antibiotics, first generation cephalosporins are given. All right. Coming to second generation. In second generation, you have to remember for gram positive cocci that you give for gram positive cocci. They won't ask you the name. Just gram positive cocci, and that too very rare. I haven't seen any question. Okay. Coming to third generation, gram negative. Okay. Fourth generation, gram negative organism, Pseudomonas. Okay. Fifth generation does not cover Pseudomonas and it will cover rest of them. Okay. So basically तो they won't be asking you कि कौन से बैक्टीरिया में आप कौन सा जनरेशन दोगे. What they will be asking you is they will say कि first generation drug में कौन से आ रहे हैं, and as it is similar to mechanism is similar to penicillin, so they will give you, अगर Pseudomonas का पूछेंगे तो पूछेंगे. That's all. I haven't seen any question in exam and NBM. UL पूछ सकते हैं because UL is a question bank and there are so many extra things in UL. Okay, so don't worry about cephalosporins and all this stuff. You can just avoid this and remember the name of the drug in each of the generation. Okay, और बाकी क्या है? Yeah, they have asked this over here. Disulfiram-like reaction is important. Vitamin K deficiency is important, and mechanism of resistance. This is very important. This is very important because what will happen is they will say that the patient was prescribed any cephalosporin, and after that the bacteria was resistant to that. So what is the mechanism of resistance given by the bacteria? Okay, so instead of giving cephalosporin, they might give the name of a drug. And name of a drug, from the name of a drug, you have to pick it out whether it is cephalosporin or any other particular drug. Okay, so this is how the questions are going to be asked. And believe my word, this is very high yield. Resistance, mechanism of action, antimicrobials में ये दो चीजें बहुत important है. Please इसमें compromise मत करना. Don't compromise here. Okay, coming to beta lactamase inhibitor. Yes, another very high yield stuff. So clavulanic acid, avibactam, sulbactam, tazobactam. Now they will give you कि amoxicillin के साथ mostly clavulinate and all this stuff. So, and why they are given? In order to protect the antibiotic from destruction. That's it. But remember the name of a drug over here. Okay, एक के साथ combine करके उसको protection मिल जाएगी. All right. So these are the few points in all this penicillin related drugs that you have to remember, and mechanism of resistance जहाँ जहाँ आपको दिखता है, it becomes very important. Coming to carbapenem. Now carbapenem again, it is related to beta lactam. So again, mechanism is going to be same. Remember the drug, and here you have to remember few important points. First one becomes bind penicillin binding protein, inhibition of cell wall synthesis, cell death. Always administer with cilastatin, inhibitor of renal death to decrease inactivation of drug in renal tubule. And remember, this is very important. Questions have been asked so many. Okay. Another. What is important over here? This adverse effect. GI distress, rash and CNS toxicity is very important. Okay. अगर कोई ड्रग की सिम्टम में आपको CNS toxicity दिख रही है, always think about carbapenem. Alright, not always, but if we are talking about antimicrobial, think about carbapenem. Alright, and what else is important here? That's it. Mechanism of resistance यहाँ पे भी है. Sorry. Inactivated by carbapenemase produced by this. जहाँ जहाँ mechanism of resistance है, and if I forget and I don't make you note it down, मेरी गलती होगी वो. Mechanism of resistance is very important. Coming to HTO mechanism, left subsoluble beta same prevents peptidoglycan cross linking by binding to penicillin binding protein 3. Now here थोड़ा mechanism अलग हो जाता है. So remember the mechanism. Synergistic with aminoglycoside. यहाँ पे clinical use is gram negative rods only, and here it becomes important because they have specifically mentioned gram negative rods only. Okay, so this becomes important. Another important point is non-toxic. HCO नाम mechanism याद रखो, gram negative याद रखो. Coming to vancomycin, again यहाँ पे mechanism थोड़ा अलग हो जाएगा. Okay, आगे gram positive bugs only. HCO नाम gram negative, vancomycin gram positive only. Okay, and adverse effect is important. Remember this image. Well tolerated in general but not trouble free. Nephrotoxicity, ototoxicity, thrombophlebitis, diffuse flushing, vancomycin infusion reaction. Idiopathic reaction largely preventable by treatment with antihistamine. Guys, everything is very important over here. Vancomycin का पक्का एक सवाल 100% आएगा because in the 6 NBMEs that were present, the new one, I think 3 to 4 NBME had the question related to vancomycin. So vancomycin is for sure going to come. Everything is important. Each and every side effect is important. This image is also important. And here you know mechanism of reaction है, resistance है, that is also important. Okay, see, pharma is just about mugging up. इसमें कुछ समझने लायक नहीं है. In whatever the systems I am taking, all the systems that I took, I told the students everything. Pharma में कुछ समझने लायक नहीं है. You just have to remember the mechanism of action. You just have to remember the side effect. That's it. How you are going to go. Okay. So pharma में my job is to आपको बता दूं कि what is high yield so that you don't mug up the unnecessary information, don't forget the necessary information. All right. So vancomycin done. Move on to protein synthesis inhibitors. अभी हमारा cell wall inhibitors वाला गया. So now we have protein synthesis inhibitors. There are 30S inhibitors, there are 50S inhibitors. Remember which are 30 and 50S. Okay, you will be confused for sure. Now coming to aminoglycides. Remember the name of a drug. Sorry. Remember the name of a drug. Mechanism is again important. You know what is important? Even bactericidal is also important. In the question, they will ask you which of the following is a bactericidal drug. That's it. That's important. Okay. So each and every line is important in mechanism, guys. Please don't compromise over here. Clinical use, gram negative rod, synergistic with beta lactam antibiotics, very important. Okay. Another point. Neomycin is given for bowel surgery. If they ask about bowel surgery, think about neomycin. Coming to adverse effect, nephrotoxic, neuromuscular blockade, contraindicated in myasthenia gravis, ototoxicity with loop diuretics. With loop diuretics, okay, loop diuretics ही दिया हुआ है. So if they say furosemide or anything like that, to think about aminoglycides can't be given together, it will be ototoxic, teratogenic. So I am marking here adverse effect as very high yield because each of the adverse effect has given one question in U1. Okay, mechanism of resistance, important. Everything is important. I'm sorry you have to remember everything, but you have to. All right, I even did. You also have to do. Coming to tetracycline. Tetracycline, remember the drug name. Again, remember this. And what else you are going to remember? Bacteriostatic. Apart from this, don't give with milk and antacid or any other thing because divalent cations inhibit drug absorption from drug. Very high yield. Clinical use, or you can use one important clinical use that they ask is also used to treat acne. Okay. Adverse effect, obviously very important. GI distress, Discoloration of teeth and inhibition of growth in children, very important. Photosensitivity, very important. Okay, so I will highlight this also. Mechanism of resistance, efflux profile. All right. Moving to tetracycline, it is also a type of tetracycline. Bind to all this. So remember this, and that's it. Nothing else in tetracycline. They will say that the tetracycline was used. What is the mechanism of action of tetracycline? Directly answer आपको question पूछेगा. Okay. Coming to chloramphenicol, remember this. Remember this. And इसमें adverse effect में remember gray baby syndrome and aplastic anemia. Okay. And why gray baby syndrome occurs? Because of this. So you have to remember these three adverse effects. Okay. Chloramphenicol is used in the Rocky Mountain spotted fever. Okay. Rocky Mountain spotted fever is important. Coming to clindamycin. Remember the mechanism. And in adverse effect, you will remember pseudomembranous cholecystitis. We saw this in ampicillin and amoxicillin also. Okay. Yeah. Another important point. Clindamycin, you will confuse it with the metronidazole. So उसके लिए एक लाइन दिया हुआ है यहाँ पे. Treats anaerobic infection above diaphragm, whereas metronidazole below diaphragm. All right. See, I am saying clinical use में I am not focusing more because I am telling you step 1 is not going to ask you कि ये disease हुई है, so what will be the treatment of choice. That is the duty of step 2 CK. Step 1 में ये सब नहीं पूछेंगे. Okay. So pharma में again you have to keep one point, that is mechanism of action. Second, adverse effect. Third, mechanism of resistance. The 3 points you have to make your pharma strong. Only in antimicrobial. बाकी सब में resistance पूछते ही नहीं है. All right. Moving to line solid. Line solid में again mechanism important है, resistance important है. इसमें देखते हैं myelosuppression is important, peripheral neuropathy and serotonin syndrome is very high yield. Serotonin syndrome is very high yield. Okay, so I'm marking adverse effect also important. Coming to macrolides, I think I have one important point in yeah, one important point in tetracycline. Please write it down. It is also used in tick borne bacteria. Okay, मतलब जिसमें ticks होते हैं, or you can say zoonotic bacteria or spores. Okay, tetracycline is also used there. Another important point is, yeah, if we give clindamycin plus gentamicin, it is a treatment for polymicrobial uterine disease. Okay, so these 2-3 points are important. If you want, note it down. All right, moving ahead. Macrolides. Now macrolides become pretty high yield because so many questions are there and you will be confused in macrolide. Remember the drug name, remember the mechanism, clinical use you can avoid. Adverse effect is important. See, so many adverse effects. So GIT, arrhythmia by prolonged QT interval, hepatitis, eosinophilia, increased serum concentration of theophylline, clarithromycin and erythromycin inhibit cytochrome P450. Okay, mechanism of resistance very important. And guys, every adverse effect has one question in UI. Okay, so make sure you know this very properly. Macrolide I will mark as very high. Coming to polymyxin, polymyxins again mechanism याद रखो. Adverse effect में you have to remember one thing, that is neurotoxic and nephrotoxic. Okay, neuro and nephro अगर किसी में मिल रहा है antibiotic, think about polymyxin. But in general, if you get nephrotoxic and neurotoxic, you should think about the drug in immunology. Cyclosporine, tacrolimus. Okay, they are also nephrotoxic and neurotoxic. Alright, मतलब दोनों में से एक नहीं है, but cyclosporine is there. Okay, so keep this in mind. That's it. Now see what I have done. I am going to show you what I have done in my book, and I want you also to do the same. मैंने सबके मैकेनिज्म लिख के रखे and I have written down the name of drug. Okay, so even I want you to do the same because this is how you are going to remember the antimicrobials, and this is just the antibacterials. We are just doing antibacterials now. Mechanism of action आएगा फंगल्स का, वायरस का, okay, प्रोटोजोआस का भी आएगा. So this is because very important antimicrobials and pharma में you should never miss a question. Pharma is a score booster. If your pharma becomes strong, you are going to pass definitely. तो एवरीथिंग रिलाइज ऑन फार्मा. फार्मा के कम से कम 40-50 सवाल आएंगे, एंड इफ यू डू दैट प्रॉपर्ली हाफ ऑफ द जॉब इज डन ओवर देयर. ऑलराइट, so make sure you do your pharma job. Moving ahead, we have sulfonamide, and along with that we'll be doing trimethoprim. Okay, because we give them together, let's just see. Drug याद रख लो, because even though we are doing it together, remember the name of the drug at least. Okay, remember this mechanism. Now coming towards the adverse effect, hypersensitivity reaction, G6PD or what? Wait, let me tell you what is important. Stevens-Johnson syndrome is important. Displace other drugs from albumin is important. Nephrotoxic is important, and hemolysis if G6PD deficient. So this is important. Everything is important. Coming to trimethoprim, hyperkalemia, very important. Megaloblastic anemia, very important. Avoided with co-administration of leucovorin, very important. ऑलराइट, तो ये दो चीजें आपको याद रखनी है. दिस इज द हिंट, और दिस इज जस्ट द समरी फॉर द मैकेनिज्म ऑफ बोथ ऑफ देम. कमिंग टू डेप्सन, वही सिमिलर तो है यहाँ पे. what you will see, डेप्सन का they have asked the use. okay, in the UL they have asked the use of डेप्सन so many times. so लेप्रोसी में यूज होता है, एंड न्यूमोसिस्टिस जेरोविसी में यूज होता है. दिस इज यू हैव टू रिमेंबर हियर. ओके, बाकी एडवर्स इफेक्ट वही सेम जो उसमें है वो इसमें. ऑलराइट, so done with this. Coming to fluoroquinolone, again very high yield drug. Okay, so let's just see. Drug के नाम याद रखो, and in this you have to remember respiratory fluoroquinolone as well. Respiratory भी याद रखना, because sometimes they will ask you there is a problem because of the respiratory system, and so you have to remember कि respiratory fluoroquinolone कौन सा है और normal fluoroquinolone कौन सा. Let's just see. Of course, mechanism is important. Mechanism of resistance is important. और इसमें क्या देखते हैं, GI upset. You have to remember headache, dizziness, myalgia. You have to remember another thing. Contraindicated during pregnancy or breastfeeding and in children less than 18 years of age due to possible damage to cartilage. Some with prolonged QT interval. So इससे पहले वाला QT interval कौन सा था? Erythromycin वाला, macrolides. And now another with QT interval you have fluoroquinolone. Okay. May cause tendonitis or tendon rupture in people greater than 60 years of age, or patient taking prednisone. So this is very important. Do this properly. All right. Now I see, if we go practically now, if we go towards the ophthalmologist, and if we have any problem in the cornea or anything like that, so what they will prescribe? Levofloxacin plus prednisolone. And see what we have studied over here. So this is the problem in theory and practical. I don't know. देखते हैं. So don't ever apply the practical knowledge in the step 1, please. Okay. जो theory है वही step 1 में apply करनी है. Don't ever apply practical knowledge in step 1. You will get it wrong definitely. Daptomycin, remember the mechanism. Adverse effect, इसमें myopathy and rhabdomyolysis, very important. Myopathy and rhabdomyolysis is very important. Okay. It is not used for pneumonia. This is also important. Okay. तो अगर कोई ड्रग आ रहा है जिसमें मायोपैथी एंड rhabdomyolysis करेक्ट मतलब कर रहा है, तो think about this. And they will say in the UL, they ask if daptomycin is given, what you will do? You will monitor CPK levels. This is very important. Okay. Coming to metronidazole, remember this. एडवर्स इफेक्ट में आपको डाइसल्फोराम लाइक रिएक्शन विद अल्कोहल, मेटालिक टेस्ट. नाउ अंदर इंपॉर्टेंट पॉइंट है, ये आपने आगे पढ़ाई. ओके, दिस वी ऑलरेडी डिड and can be used in place of amoxicillin and aspirin triple therapy in case of penicillin allergy. This is important. Disulfiram-like reaction is important, and this is important. They have asked so many questions regarding this. In exam also, I got this question. In NBME also so many questions, and in UL also so many questions. So this is for sure you can 100% going to come. Okay. So I think we are done with the bacteria. Now we are with the tuberculosis. That is also bacteria, but it is given a separate part, antimicrobial therapy. Just give me a minute. All right, let's continue. Antimicrobial therapy. Leave this. Okay, leave this. No need to focus here. But अभी आते हैं mechanism और उस पे, because they, as I told you, they won't be focusing on what you will give for treatment or something like that. Okay, they will focus on the drug and the mechanism. Now, rifamycin में mechanism is important. Along with that, adverse effect is very important. ये तो आप छोड़ ही दो. Never they are asking. Okay. Minor hepatotoxicity, increase in cytochrome P450, orange body fluid. Rifabutin favor over rifampin in patient with HIV infection due to less. So each and everything becomes important here. Mechanism of resistance important. So this is the hint that they have given you. Okay. So that's it. इसमें कुछ extra point नहीं है. Coming to isoniazid. In isoniazid, remember the mechanism. Remember mechanism of resistance. Now let's just see what is important here. Hepatotoxicity, P450 inhibition, drug-induced SLE, vitamin B6 deficiency, and administer with pyridoxine B6. Now see, what happens over here is this is metabolized. This is the part of UL that I'm writing. Okay, so you can note it down. It is metabolized by liver enzyme. Metabolized by liver enzyme and acetyl transferase. What it does, it slows. That's it. That's it. This is the not detail. Okay. It is metabolized by liver enzyme and acetyl transferase. Now on the thing, increase in ALT means asymptomatic. All right. And what else is important over here? Yeah, one important point in the clinical use, also used as a monotherapy for latent TB, and it is the only agent used as solo prophylaxis for TB. अगर कोई भी एक ड्रग ही देना हो किसी को तो isoniazid is what you need to do. All right, that's it. Coming to pyrazinamide. Pyrazinamide. Okay. Pyrazinamide mechanism uncertain. So not यहाँ पे mechanism नहीं है. You are safe. You have to remember hyperuricemia. You have to remember hyperuricemia. Coming to ethambutol. Remember this. And another point is optic neuropathy, red green color blindness. That's it. Coming to streptomycin. Remember this and remember this. That's it. Nothing else. See, I'm telling you again, pharma is boring, but you have to remember mechanism and side effect. Now see, sometimes how they will ask you anti-tuberculotic drug is, they will give you a case of isoniazid and they will give it a side effect. Most common side effect they will be asking you about is B6 deficiency. Okay, B6 deficiency they will ask. In ethambutol, they will directly give, the patient can't see the red and green color. All right. And in rifampicin, the most commonly asked, they will say that is sclera turned orange, his urine turned orange, everything turns orange. Okay, so if it is this, you should be knowing if I'm fit. All right, mechanism of resistance, and everything you have to do. All right, just give it a read over here. You won't require this, but just give it a read. This is important. Prophylaxis in HIV patients at age 8. Prophylaxis may everything you will give TMP SMS. Okay, everywhere. Okay, if CD4 less than 100, 200, you will be giving TMP XMS. Okay, just a minute. Please come later. Okay, so एक मिनट. I'm sorry. Like my roommate just came. Sorry for that. So yeah, now coming to antifungal therapy, you have to remember this is the summary that they have gave same in the antibacterial therapy. Similarly, antifungal, you have to remember the mechanism, adverse effect. Okay, so amphotericin है, remember the mechanism, remember the adverse effect. Adverse effect में कैसे याद करना? I am telling you in amphotericin B, fevers and chills, shake and bake, hypotension, nephrotoxicity, IV phlebitis. Now I think they have given less over here, so I'll write down for you. In adverse effect, remember renal tubular acidosis 1 also. Okay, renal tubular acidosis 1. Another one, headache also is important. Okay, and another one is, yeah, supplement potassium and magnesium because of altered renal tubule permeability. This is very important. And what is important is the okay. Now see, whenever you are making the diagnosis of systemic fungi, okay, systemic fungi most commonly they are this histoplasmosis, ब्लास्टोमाइकोसिस ऑल दो. सो वो जो फर्स्ट पेज में जो भी फंगस दिए हुए हैं ना, हिस्टोप्लाज्मोसिस, कोक्रीडियोमाइकोसिस, ब्लास्टोमाइकोसिस, पैराकोक्रीडियोमाइकोसिस, दिस इज गिवन इन द फर्स्ट पेज ऑफ फंगस. ओके, तो इसमें द ट्रीटमेंट इज गोइंग टू बी एम्फोटेरेसिन बी. ओके, इसमें ट्रीटमेंट एम्फोटेरेसिन बी ही होगी. बट व्हेन यू डू कैंडाइडा, व्हेन यू डू एस्परगिलस, व्हेन यू डू क्रिप्टोस्पोइड, सॉरी क्रिप्टोकोकस, उसमें थोड़े चेंजेस आ जाते हैं एंड दे हैव गिवन द पर्टिकुलर ड्रग फॉर ऑल ऑफ देम. बट जो पहले के 4 जो फंगस है ना, उसमें आंख बंद करके आप एम्फोटेरेसिन बी डाल देना. ओके, so I think that's all for the this. And one important line in UL that they have given here is fungal cell wall has ergosterol and no sterol, that is cholesterol. ओके, ये लाइन याद रखना, वर्ल्ड में दे रखी है. कमिंग टू निस्ताटीन, निस्ताटीन में मैकेनिज्म याद रखो सेम है एंड नथिंग एल्स. ओरल कैंडिडियासिस में देते हैं खाली. ओके, ओरल कैंडिडियासिस. फ्लूसाइटोसिन, रिमेंबर द मैकेनिज्म. एंड यहाँ पे व्हाट यू विल डू इज, या यू विल गिव दिस इन क्रिप्टोकोकस meningitis. इन क्रिप्टोकोकस में आप फ्लूसाइटोसिन दोगे along with amphotericin B. फ्लूसाइटोसिन very important. Nystatin very important. Coming to azoles, remember this. Adverse effect में remember testosterone synthesis inhibition, so there will be gynecomastia, liver dysfunction, and QT interval prolongation. So till now we have done 3 antimicrobials with QT interval prolongation. First one macrolide, second one fluoroquinolone, third one azole. Okay, that's it. इसमें एक important line है, itraconazole may be used for this, clotrimazole and miconazole for topical fungal functions. And another point was, that's it. Okay, so sometimes in the question they have asked about itraconazole. Okay, so keep this in mind. Moving ahead, terbinafine, remember the mechanism. एडवर्स इफेक्ट में आप याद रखोगे टेस्ट डिस्टर्बेंस, टेस्ट डिस्टर्बेंस याद रखोगे. एंड यस, हियर यू हैव टू रिमेंबर क्लिनिकल यूज. टेर्बिनाफ्रेन आर यूज्ड इन फिंगर और टोन, इसमें डर्मेटोफाइटोसिस का जो फंगस होता है ना, तो उसमें आप यहाँ पे याद रखो. मूविंग अहेड, Echinocandin, remember the mechanism, and यहाँ पे फ्लशिंग हिस्टामिन रिलीज का फंक्शन. रिमेंबर द नेम ऑफ द ड्रग. यहाँ पे साइड इफेक्ट इंपॉर्टेंट नहीं है, ड्रग एंड मैकेनिज्म इज इंपॉर्टेंट. ग्लिसरोफल्विन, remember this. Side effect में you will remember. Wait, I don't think anything is important in side effect over here. Just only this much, only this much. Okay? क्योंकि ये जो ड्रग्स है ना, ये सारे वन वन स्पीसीज के लिए यूज होते हैं, particularly skin fungal infection. Okay, that is what they have given, dermatophytes. But यहाँ they will not ask again where it is used. In the question they will say it was used here, and then they will be asking you mechanism. So mechanism very important, very important. एंटीप्रोटोजोल थेरेपी देख लेते हैं, एंड देन वी आर लेफ्ट विद एंटीवायरल्स. तो एंटीप्रोटोजोल में आपको यही देखना है. ये एंटीप्रोटोजोल थेरेपी में सबसे पहले तो वी हैव पायरिमेथाजिन, सुरामिन एंड मेटाबोल. एक मिनट रुको, यहाँ पे दे हैव गिवन समथिंग. या तो पायरिमेथामाइन, सुरामिन एंड मेलाप्सोफोल, नीफर्टुमक एंड सोडियम. सी, ये आपके पर्टिकुलर ड्रग्स है, यू हैव टू रिमेंबर दिस. कौन से प्रोटोजोल में कौन से ड्रग यूज होता है. नाउ सी, परमेट्रिन एंड मेलाथायोन, इवरमेक्टिन, एंड दैट्स इट. तो इसके लिए मैकेनिज्म दिया हुआ है यहाँ पे. ओके, मैकेनिज्म इज गिवन ओवर हियर. हु इज दिस? क्लास चल रही है, बाद में आया. तो या, so see, in this edition they have totally, changed it. So I will write it down for you. परमेथ्रिन का लिख लो. Permethrin, you have inhibits sodium channel deactivation. Okay, and it will cause neuronal membrane depolarization. This is given in the old edition, so I want you to write it down. So ये जो acetylcholinesterase inhibitor है, that is for melathion. Okay, and apart from this, that's it. Okay, so इतना याद रखना. ये परमेथ्रिन का they have asked in the exam. I don't know why the new edition removed it. Alright, now moving to chloroquine. Remember the mechanism. And another point, treatment of Plasmodium species other than Plasmodium falciparum. And another point is it causes retinopathy. Not important. Chloroquine भी इतना important नहीं है. They will just ask you the mechanism. That's it. Anti-helminthic therapy में mebendazole is microtubule inhibitor. Praziquantel का ये रहा. तो mechanism ही याद रखना है आपको. See, while I was teaching the parasitology, so वहीं पे along with discussing the organism, I discussed the drug. Okay, that is the only place in microbiology where you have to remember कि कौन से organism में कौन सा drug दे रहे हैं, because it is not like बैक्टीरिया. बैक्टीरिया में कैसे होता है कि आपको कोई भी बैक्टीरिया आया, आपने पूरा एक क्लास दे दिया, एंड इन दैट सो मेनी ड्रग्स आर देयर, सो इट बिकम्स डिफिकल्ट टू रिमेंबर. व्हेयरएज प्रोटोजोआ में ऐसा कुछ नहीं है, जस्ट 4 to 5 ड्रग्स आर देयर, एंड देन यू हैव टू थिंक अबाउट दैट. ओके, सो जब भी आप पैरासिटोलॉजी करो तभी ड्रग्स याद कर लेना. ओके, दैट्स इट. So I think antifungals are done. Coming to the last part of the today's class, we have antiviral therapy. Okay, we have antiviral therapy. Again, same thing, mechanism, side effect, and yeah, ये जो एंटीवायरल थेरेपी में HIV थेरेपी है ना, उसमें आपको काफी सारे ड्रग्स याद करने पड़ेंगे, because each and every drug are having their own specialty. Alright, so let's start with acyclovir. No, sorry. Let's start with oseltamivir. Oseltamivir is used in influenza neuraminidase. तो मैकेनिज्म याद कर लो. That's it. कोई साइड इफेक्ट नहीं याद करना. Baloxavir is a new drug, not given in the old edition, but दिया हुआ है, तो सिर्फ मैकेनिज्म याद कर लेना. रेमडेसिविर, कोविड ड्रग, तो ये इंपॉर्टेंट हो जाएगा. रिमेंबर दिस. दैट्स इट. इसमें तो मैकेनिज्म ही करना है, साइड इफेक्ट भी नहीं करने. गुड फॉर यू. कमिंग टू एसाइक्लोविर, फेमिसाइक्लोविर एंड वेलासाइक्लोविर, दिस पेज इज वेरी इंपॉर्टेंट बिकॉज यहाँ पे कुछ चीजें हैं अपार्ट फ्रॉम मैकेनिज्म यू हैव टू रिमेंबर. लेट्स जस्ट सी. मैकेनिज्म में आप ये तो याद कर ही लोगे. ओके, सिमिलरली मैकेनिज्म, मैकेनिज्म एंड मैकेनिज्म. तो चलो एडवर्स इफेक्ट देखते हैं. नाउ सी, ए साइक्लोवेर जो है ना, नो एक्टिविटी अगेंस्ट सीएमवी. तो सीएमवी अगर इन्फेक्शन आपको पूछ रहा है तो आप उसमें ए साइक्लोवेर नहीं दोगे. ओके, because CMV lacks thymidine kinase necessary to activate guanosine analog. This is important question was asked in NBME. Okay, बाकी सब में आप दे सकते हो, नो प्रॉब्लम. एडवर्स इफेक्ट में क्रिस्टलिन नेफ्रोपैथी एंड एक्यूट किडनी इंजरी. कमिंग टू गन साइक्लोवेर, सीएमवी में दे सकते हो. एंड इसमें ये आएगा ल्यूकोपीनिया, न्यूट्रोपीनिया एंड थ्रोम्बोसाइटोपिनिया. दिस इज वेरी इंपॉर्टेंट. ओके, रेनल टॉक्सिसिटी आएगा. नाउ इसमें और क्या था? Yeah, it is in phosphonate, no problem. Okay, so इतना याद रखना. In phosphonate, remember this: nephrotoxicity, multiple electrolyte abnormality can lead to seizure. So इसमें electrolyte कौन से abnormalities होगी? Calcium. There will be phosphate abnormality. There will be decrease in potassium, decrease in magnesium. Okay, so these are all the abnormalities that you have to remember. And see, in the question, one of the question in UL, it is there: CMV retinitis in immunocompromised patients when gun cyclovir fails. ओके, गन साइक्लोविर पहले दे दिया होगा बट उससे ट्रीट नहीं हुआ, सो यू विल गिव फोस्कारनेट. कमिंग टू सिडोफोविर, सेम थिंग, नेफ्रोटॉक्सिक. ओके, सो ये सब तो आपके नॉर्मल एंटीवायरल्स हो गए. मोस्ट कॉमनली दे विल बी फोकसिंग ऑन ए साइक्लोविर एंड गन साइक्लोविर. ओके, फोस्कारनेट के इसलिए फोकस करते हैं बिकॉज दे कॉजेज आयरन लॉस. ऑलराइट, so I think we are done with the normal antiviral therapy. Now we'll go towards the HIV therapy and that will be the last part of our today's class. HIV therapy फटाफट कर लेते हैं. And yeah, you have to remember this कि एंटी रेट्रोवायरल थेरेपी में होता क्या है. ओके, तो NRTI, NRTI, integrase inhibitors, protease inhibitors, entry inhibitors. So now there will be two types of how the questions will be asked for the mechanism in HIV therapy. तो इसमें क्या होगा? Either they will give you this or they will give you whether they are integrase inhibitors or protease inhibitors or something like that. Okay, तो पहले मैं इसमें बता देता हूँ क्या इंपॉर्टेंट है, फिर आई विल सेपरेट इट एंड राइट इट डाउन फॉर यू. तो ये आपका मैकेनिज्म आ गया. नाउ हियर tenofovir. Tenofovir is a nucleotide, the others are nucleoside. This is important line. ZDV, that is gyrovidin, can be used for general prophylaxis and during pregnancy to decrease fetal transmission. Okay, another thing, ये जो डाइडेनोसिन है ना, यहाँ पे they haven't given. Wow, there is one drug didenosine that is also NRTI. So didenosine causes pancreatitis. Okay, this is very important. युगल में question है. Then this abacavir contraindicated if patient has this mutation. Then it can also cause lipodystrophy. This drug can also cause lipodystrophy. Okay, it will cause, they have not given lactic acidosis also. Lactic acidosis भी करेगा. Okay, all these are very important. Please write it down. Lamivudine जो है, it is causing peripheral neuropathy. Okay, it is causing peripheral neuropathy. All right. So I think that's all the important point that I want you to write it down for you. And please, you also write it down. इसमें नहीं दिया है, but it is important. And this drug is also important. Diadenosine. UL has one question stating pancreatitis. All right. Coming to double NRTI, you should not give them during pregnancy. Okay. तो ये तो हो गया. रैश एंड हेपेटोटॉक्सिसिटी, विविड ड्रीम्स एंड सीएनएस सिम्टम्स. विविड ड्रीम्स का अगर कुछ पूछते हैं, straight away think about NNRTI. Remember the drug name. Okay. Coming to integrase inhibitors. So एक लाइन मैं लिख देता हूं आपके लिए. Prevents synthesis of वायरल mRNA। ओके, ये भी लाइन यूवल में है, ये भी आपको याद रखनी है। एंड हियर यू हैव टू रिमेंबर क्रिएटिन काइनेज, इंक्रीजिंग क्रिएटिन काइनेज। रिमेंबर द ड्रग नेम, इंटीग्रेट है तो ग्राविड ग्राविड रहेगा। प्रोटीएज इनहिबिटर्स, तो नाविड नाविड तो है ही, इसके साथ रिमेंबर दिस and remember this. The entire mechanism is very important because what will happen in anti-HIV is they will confuse you with the mechanism. Mechanism में वो लोग ऐसी इंग्लिश यूज करेंगे कि you will be confused. In spite of studying, you will be confused. Okay, so keep this properly. Hyperglycemia is important. GI intolerance is important. And what is important here? Is cytochrome P450 inhibitor. And इसमें और क्या है? They haven't given this nephrotoxicity, nephropathy. They haven't given hematuria. They haven't given thrombocytopenia. And yeah, when you give and see this nephropathy, hematuria, and thrombocytopenia, I am marking this with blue. This is associated with indinavir. They haven't given the name only. Indinavir. The new edition is very bad. Okay, so indinavir के साथ आता है, and in the question they will say if indinavir is given, what is important? So adequate. I'm writing again. Adequate hydration is necessary. UL में question है. If they have used indinavir, you have to give adequate hydration. और इस nephropathy, hematuria, thrombocytopenia के chances है. Coming to entry inhibitor, last type. Remember this. Remember this. And Maraviroc inhibit docking and this at the injection site. So HIV में जो आपने proteins देखे होंगे ना, if you are thorough with that, your this drug will be good to go. Okay. So pre-exposure prophylaxis, this is something new. This is not in the old edition. So let's just see इसमें क्या है. Administer to patients with negative HIV test. Men who have sex with men without protection, sexual activities, HIV partner, multiple partners of unknown HIV, injection drug used with high risk. So इसमें आपको tenofovir plus M देना पड़ेगा. Okay, so this is something new, and might be you will might have added this in the new set of questions. So I'm not sure. So just remember this. Okay, coming to hepatitis therapy, I think this is the last one. So hepatitis therapy में again same thing. ये तो याद रखो ही, but along with this remember this inhibitors का ये number भी. Okay, तो ये सब में याद रखना ही है. Along with this side effect में यहाँ पे कोई important question नहीं आया है. So they will just give you the name of the drug and you have to remember the mechanism of action. So with this we are done with antimicrobials and this part important है, तो एक बार देख लेना. And if you are using FMG and NEET PG for first aid, if you are using first aid for FMG NEET PG, this becomes very high yield. UL में 2-3 सवाल है regarding this. So this is very easy. Just याद कर लो कौन सा polycidal है कौन सा नहीं है. Alright. And this is one note they have given, antimicrobials to avoid in pregnancy. We have already done this before. We're already doing it now again. So with this, we finish the microbiology part. We finish the antimicrobials. So that's all for the today's class. So I think Sumedha and this other guy, Tranquility, is they have joined the demo class. Thank you for joining till the end. There were so many of them. They just left. And if you are having any doubt related to anything in USMLE, okay, not just about first aid or anything, अगर USMLE के related भी कोई doubt है, you are free to discuss it now. मैं आपका activity कर देता हूँ. Okay, so Sumedha has no doubt. Tranquility, if you have any doubt, I think no doubt. So I think the class is over for today, and that's it. Thank you for joining.